Hello, I'm Dr. Todd Seelhammer from St. Paul, Minnesota. And I'm here to talk a little bit about what kind of rashes are common in children and when it's important to see a dermatologist. The most common form of rashes that we see in children tend to be infectious in nature. Things like viruses, bacteria, or fungus can cause many rashes. Other rashes are things such as eczema, which we see quite frequently on kids, from the newborn age all the way through childhood and even into adulthood at times. Other rashes can happen in adulthood and in children, things such as hives, allergies to things such as medications or creams, or other rashes such as psoriasis. Some people like to know, and I think it's important to know, when is it important to bring my child in for closer inspection? I think the biggest thing is if it's starting to interrupt a child's daily activities, such as playtime, eating, sleeping, interacting with mom or dad or other kids, and it's interrupting that activity, I think it's important for a closer look. Specifically, if the rash is expanding rapidly, up the chest, towards the neck or face, or down towards the groin area, that might be something worthwhile to have evaluation. If there's blistering, especially around the mouth or on the hands, it needs closer look. If it's starting to cause systemic symptoms, that means things such as headaches, kind of difficulty with pulling on the ears, difficulty with eating, pain with bowel movements, or the child is just not acting like they normally do, it's at least a worthwhile call to your pediatrician or dermatologist. Treating rashes is pretty variable and it can depend on what the cause of the rash is. It might be as simple as close observation. It might be more advanced, requiring treatments such as creams, lotions, pills such as antibiotics or antiviral medication, and sometimes even light treatments such as lasers. All in all, it's important to know that kids respond very well to treatment and they usually rebound quite quickly. But if in question, it's always important to have a look by a professional. Some people really want to know, are there certain rashes that are more common in babies, in the newborn age? And the answer to that is, of course, there are. Some of the more common, and by far the most common in my experience, is a simple diaper rash. Most newborns have that at least for a short time. It's often treated very simply with things such as barrier creams, but sometimes it needs a more advanced treatment, and there are some prescriptions that can be quite helpful. Other rashes that we see more commonly on young children, especially babies, are rashes after vaccination or really after any viral exposure. Rashes are quite common. And again, that tricky eczema is starting in that time period as well. Again, I want to reiterate that if a person's ever in question whether their child should be seen or not, it's better to hedge on the side of caution and call your primary care doctor or your dermatologist.